everybody, and thank you for joining us once again for another episode about our chat about aging in the community. We're really pleased today to have a number of guests with us who are going to be talking about a very exciting and innovative program that combines older adults with students from the University of Toronto in learning about aging and as part of the university program. And I'm really excited to have our guests here today. We have two of the instructors from the program, as well as two of the students, one of the older students and one of the University of Toronto students. So without further ado, I'd just like to introduce everybody to you. We have the professor of the course, Dr. Raza Mirza, who has been working with the University of Toronto for a number of years. His areas of expertise and teaching interests include research methods and evaluation, medical decision-making, as well as the social behavioral determinants of health in persons aging with a chronic illness, aging in place, and factors such as social isolation and loneliness, influencing late life social, mental, and physical well-being. Dr. Mirza is the Director of Partnerships and Knowledge Mobilization with HelpAge Canada and Assistant Professor status at the University of Toronto's Factor-Inwentash Faculty of Social Work Institute for Life Course Aging. Welcome, Dr. Mirza. We also have with us Jessica Hsieh, who works with Dr. Mirza in delivering the program. Jessica is a PhD candidate at the Factor-Inwentash Faculty of Social Work as well, and she received her Master of Social Work degree with a specialization in gerontology from the University of Toronto and her Honors Bachelor of Arts degree in psychology from York University. Her current PhD research is focused on elder abuse of persons living with dementia by their adult child caregivers. Jessica has extensive experience in research project management and most recently led a diverse range of research projects focused on elder abuse within the community. So those are our two program organizers and leaders. But we're also delighted today that we're going to have two of the students in the program that we're going to be talking about with us. We have Florene Shruber, who is an advocate, teacher, educator, lawyer, and was principal of Montessori Teachers College and Montessori Dementia Program. She is really keen to share with us her experience and believes that older adults have much to offer to younger students, taking a longer view on issues, maturity, stability, and education and experience. And last but not least, we have Alexis Hart, who is one of the students in the program, and she holds an Honors Bachelor of Science in Human Biology and Psychology from the University of Toronto, but has a keen interest in aging and gerontology and was part of the first cohort of the intergenerational classroom as an undergraduate student. So welcome all of you. Thank you so much for joining our podcast today. And without further ado, I'd like to start by asking Dr. Mirza, what is this program and how did it come to be?
Thank you for inviting all of us and for giving us this opportunity to talk to you. And what the intergenerational program really is an opportunity for experiential learning. I think that's the best way we can talk about it. And when we say something like experiential learning, what we're saying is we're trying to put learning about aging into context. And so what this program on the surface does is it brings together two generations that often don't interact with and engage with one another, especially in the classroom context. And so we brought our students from the University of Toronto to Christie Gardens Retirement Community to spend a semester really looking at aging and having both of the different perspectives or the generational perspectives shared, again, in the context of learning about aging and gerontology and geriatrics. And so at the very surface level, that's what this is about, is saying, let's talk about aging, just sort of like the framework for this podcast is, but let's not talk about it as an older generation, as a younger generation. Let's bring the multiple generations together and let's have a more fulsome discussion. So that's what this is really about.
So when the older learners attend the program, are they there just to share experience and perspectives, or are they actually learning and taking away a degree or credits? How does that work?
Well, the learners from Christie Gardens are active participants in the class, and they're enrolled in the class, so they have access to the same University of Toronto resources that the undergraduate students have. They're officially considered auditors of the class, and they are enrolled. And while it doesn't lead to a credit, it does lead to the recognition of the time and energy that they spend. They are eligible to write the exam. They're eligible to complete the assignments, and many of them have. I have one of them right here next to me that one of the learners from Christie completed, and they come to class prepared with the readings highlighted and questions and answers. And yeah, so they're really active participants in the class. Now, with regards to learning, we did an evaluation last year at the end of the class, and what we can see is that topics like finances and medications and how the healthcare system operates are really important subjects that older learners really took something away from the class as well.
Florene, how did you get involved in the program? Was this something that you just heard about as a resident of Christie Gardens, or was it something that you had deliberately thought you'd like to participate in?
Well, my history goes back a long time with Raza. I hired him to teach the dementia course when I was involved in Montessori. And we've over the years kept contact, and he knows my feeling about growing older and growing more independent and how important it is for younger people to understand that, especially young people who are going to work in the field. And so I've been involved for quite a long time, and I live at Christie Gardens, and so Braza came to have lunch one day, and we started talking about it, and Christie Gardens got involved, and here we are.
Well, that's great to hear. And Alexis, you actually are a graduate of the program. What was your experience like? How did it make a difference in terms of the learning that you were able to get out of the program?
Well, I have to say that it probably was one of my absolute favorite undergraduate courses that I had taken during my degree. I think having that experiential component to the course made an immense difference. I think a lot of my university courses were traditionally set up to have that lecture format where the professor is talking at you for a few hours. You sort of try to memorize information and then regurgitate it for an exam. Whereas in this course, I really had an opportunity to interact with my peers, both the undergraduate students and the older adult learners. And it was incredibly eye-opening to get to discuss some of these barriers or challenges that older Canadians are experiencing while aging with the individuals who would experience these challenges firsthand. And in addition to getting to engage with that lecture material in that way, I really just had a chance to make a lot of incredible friendships through that course too. And not just with the undergrads, but also with the Christie Gardens residents. So I think my favorite piece of that course was the connections that I was able to make with the other students.
Oh, that's wonderful. And Jessica, you kindly invited me to attend the last, I guess, program or last day of the program, and kind of a little celebration that took place at Christie Gardens, and it was just a really wonderful opportunity to see everybody and just to see how the program progressed. What's been your experience with, in terms of building relationships with the residents at Christie Gardens through this program?
I think our favorite part of the class was seeing those connections and those relationships that were built. It meant so much more than the actual lecture material and what they got from the readings, and it was the actual connections that was the best part of it. And I work at Christie Gardens now, and I still see students coming in, previous students, to visit their friends at Christie. And every time I see one of the residents at Christie who's been part of our class, they always come up to me and talk about the class. And even just yesterday, I had multiple residents come up and say, "Can I take this class again next year?" And they're always talking about their friends that they made, the younger friends that they made, and how they're going to have lunch or dinner with them. And that's the most magical part of it, those relationships.
Yeah. That's so good to hear, and I think really heartwarming to think that these relationships are enduring and going beyond, the four walls of the classroom, even though this is a great classroom setting to be working in. Because I think that's one of the challenges with aging, is that isolation and that detachment that sometimes happens away from, being part of a larger community and not just sort of sticking with people who are of one age group. Is that one of the things that you emphasize in the program, Dr. Mirza?
Yeah, I think the isolation piece is really key. And I think one of the points about this class is also that younger people face very similar issues that older people do as well. And that feeling of isolation and loneliness is one of the drivers for people to sometimes take this class. There was a number of students from the undergraduate cohort who actually asked me if they could take the class because they had not met people in their undergraduate studies, and they wanted to meet with and connect with people, and they thought that this would be a good forum for them to be able to do that. Now, addressing the isolation and the age segregation piece, the lack of intergenerational engagement, and ageism as well, those are all really key components of this class as well. And really to, like I said, to set some context for things. And, one of the questions that we ask at the beginning of the class is to say, well, at what age do you think a person is old, and why might you think that? And in previous years, people have said things like, well, a 30-year-old or a 40-year-old might be someone I consider old or older than me, and someone that I don't have anything in common with. And it's sometimes these sort of stereotypical views or myths that perpetuate into people not building bonds and friendships and saying to themselves, well, I have nothing in common with this person. And when we put people together, they very quickly forget about their ages and realize how much that they have in common. And so it does work to address that isolation and a barrier sometimes that is psychological to a really important friendship that could be formed.
Mm. Florene, what's happening now at Christie Gardens? I understand that, the program concluded, and at this point, there's no certainty whether, it's going to continue to take place at Christie Gardens. But has there been any discussion at all about how to, continue the legacy within Christie of intergenerational relationships?
Well, I'm promoting it certainly here with the administration, and I know Raza is as well, and we'll work towards doing that because it's very beneficial for both the elders and the young people. For example, how can young people work in a field with elders and not understand them and not know them? And this is a perfect opportunity for them to do that. And so I'm happy to promote it any way I can. There's lots of excitement in the building about it, and people wondering how they can sign up again next year. It's just a wonderful, mind-blowing experience that you would not expect. And you have to be there to see the energy.
Mm-hmm.
And several people have come up and told me how sad they are that it's over and what can they do. And so there's a lot of interest in that.
Yeah. One of the things that we often notice at my organization chats when we're hiring people is that inevitably, when we ask them what attracts you to working at Chats Community Home Assistance to Seniors, they'll say that other than whatever their background is, that they have an older grandparent or aunt or uncle that they've been caring for, and really want to be able to continue to work with older adults. And I think that's, on a sort of smaller level, that's one of the things of that intergenerational relationship that carries into someone's desire to work in the sector. Alexis, from your perspective of yourself and the students that you've been working with, what do you think are the factors that draw them into seeing aging and aging studies as not only an interesting area, but as a career opportunity?
Absolutely. I mean, it's a very rapidly growing cohort of the population. And I think now more than ever, it's very important that younger people are exposed to many of the challenges faced by older adults as they're growing older. I think it's definitely courses like these and having those conversations that would draw people like myself into pursuing a career in the field. For example, going into this course, I knew that I wanted to work in healthcare in some capacity, but wasn't quite set on potentially pursuing a career in gerontology until I got to have those conversations. So after taking this course, I now volunteer at Christie Gardens in long-term care just to gain that additional exposure. So I think having experiences like this and getting to have those conversations and learn about those challenges is probably one of the first steps to encouraging people like myself into exploring those careers in gerontology and aging.
And has that been your experience, Dr. Mirza, that this kind of intergenerational component really does help the students see this as a viable career path for them?
I mean, this is one of the reasons this class started, is because of 2023, I think in January, February, there was a conversation that we had as part of the Institute for Change Leadership that was with the now Mayor Olivia Chow. And one of the questions that was asked at that roundtable was to say, well, how can we better care for older Torontonians or older Canadians? And at that point, I raised my hand and I had said, well, we need to better prepare the people who are caring for older Canadians and Torontonians. And part of that is giving them exposure to courses on aging. And so whether it's a PSW or it's a nurse or it's a pharmacist or a medical doctor, part of this is giving people like Alexis and others exposure to older people. And really getting to know what it's like to not only be the recipient of care, but also someone who's providing care. And this intergenerational component really helps to, I think, bridge those generational divides that we talk about sometimes, whether it's ageism or, certain views that you might hold. So I would say definitely yes. And then the final thing I'll say about this is that this is one of the only courses on aging in the undergraduate program at the University of Toronto. And so this is a very narrow gateway that we have and a very small opportunity we have to motivate students like Alexis to continue to pursue something in aging. And I'm happy to report that one of the things I do see now is that students I've had in undergrad are pursuing gerontology because I see them again in graduate classes as well. So we do see that it does make a difference.
Mm-hmm. And Jessica, you're a PhD candidate. So how did your own scholastic progression reflect sort of this interest in aging all the way through?
Do you mean like my what I'm doing right now, or
Yes.
how did I?
Well, how did you get to this point with this particular focus?
I've had an interest in aging from a very young age. I was a caregiver for my grandmother for nearly 20 years. So I think that piece that you were talking about, a lot of people who that you see who are coming to work at Chats, they have that personal connection to it. So I had that personal connection to it. And I, like Florene, I also have a long history with Raza. We worked together in the past, and so I got connected to the course through him. But this was just such a incredible experience. And I want to just continue this work, even post-graduation. I want to do intergen work. It's seeing these connections. There's just something about it. It's like Florene said, you have to be there to see it. And there's just something so magical about it. And especially at that last class, it was the same as last year, this year. To not see students just run out after class, and for them to stay, we were getting kicked out of the room.
Sure.
I think that's when we know that we were really kind of, we did something, and it meant something to them.
Yeah, that's great to hear. Florene, what was your experience with that?
Well, the same as Jessica, but I think what was really important for me is that it's important for people working in care not to feel that all old people are frail, can't look after themselves, losing their minds, and they need not be afraid about aging. And one of the things that I learned and they learned is that if you live long enough, age 83 is going to be your best year in terms of how you feel about life and how you get on in life. And that was a wonderful step for me and for everyone in the class. And I think what I loved is the energy of the young people, of course. And I think we have so much to give young people. And that was our role always, in the earlier years, was to pass on information, help. Young people are quite, what's the word? They're having a hard time these days. And I think that we can keep them settled down. I see it with my own grandchildren, that we have the long view, and we know that you live through everything and you survive and life goes on. And it's important for young people when they're moving along. So it was just a marvelous experience. I actually sat in on the second year, almost every class again. I would probably do it again the next time we put it on.
Yeah. Well, the class that I sat in on, Dr. Mirza, you were talking about finances, and I learned, I haven't got to the point yet where, I'm looking at, what I need to do with my RSPs and so forth. But it was a learning for me, the way that you position things that people need to think about. And I was actually, as I was listening, I was thinking, well, a lot of, about half the room were people who are probably past that point of needing to figure out their finances and how they're going to reinvest their RSPs into RIFs and that sort of thing. But they were still very engaged, and still I got the sense that they were learning something new and some different way of looking at things. And you were even talking about what you would recommend to your mother, or what you were recommending to your mother. And I thought, yeah, I need to think about that too. So, it was quite valuable beyond just obviously being part of the course discussion.
Yeah, I would say that from the surface, I think maybe sometimes because we assume that people at a certain age have it figured out, what our results from our evaluation or from the research that we've done is that a lot of people, even when they're in their 70s, don't have their finances figured out or their retirement plans made because they've continued to work, or there's been some disruptive event in their life that they've had to take on caregiving for a grandchild, or they've had to go back to work, or they've gone through a late life divorce or separation. And so their finances that they had planned and really arranged for no longer make sense to them. And so one of the points that we try to raise in that last class, for example, is that there's a different type of financial literacy, for example, as you grow older than there is as a younger person. And what we would like to encourage from, conversations like the one we had on the last day is how can older people potentially share their wisdom and pass on some of their own practical experiences, like Florene was saying, to that younger cohort, and what the younger cohort can also share with the older people in terms of what they're doing to prepare for their own future older self. Yeah, so I think there's opportunities for learning and growth at all ages and at all times, and I think that's the other part that we really try to promote in this class.
Yes.
If I could just add something to what Raza said, is I haven't spoken to him about this yet, but I would like to maybe teach a class on financing. I don't know if we'd ever have time to do that, but it's very important for all ages, and most people don't do it very well.
Yes. Yeah. Alexis, any sort of observations that you had? What were some of the topics that really stuck with you that perhaps would have been different had you only been within your age cohort and studying?
I mean, we covered quite a wide range of topics throughout the course. I remember we had a caregiving panel that had quite an impact, where Dr. Mirza had invited in a series of caregivers of different ages who were either looking after parents. I remember last year someone had come in who provided care to older adults living with HIV, or he was running a support group for them. So it was an incredible experience getting to hear from those individuals firsthand. I know in the previous podcast episode for chats that I had been listening to, someone had mentioned that a lot of the time individuals don't quite realize that they are a caregiver, or they sort of shy away from labeling themselves as such. So during our caregiving lecture, there's a part of the class where Raza says, well, raise your hand if you identify as a caregiver, and a few people will put up their hand, and then he'll actually list some examples that people might not consider to be a caregiving experience. And then as we look around the room, we realize that we've all been a caregiver at some point in our lives. So I think little immersive activities like that throughout each lecture were really quite eye-opening. There was another piece where we had students try on age simulation suits to sort of mirror what it might be like for an older adult to navigate the world who might be experiencing physical restrictions or trouble with their vision. So I think that was eye-opening for a lot of the students as well.
Yeah. Jessica, do you see examples of ageism when you talk about this program with either with your peers or others, who sort of say, well, why would anybody pursue this course of study?
I think everyone is very excited when I tell them about it. What I do see is it's maybe not ageism, but in our first class, we do ask all the students in the first and last class and in our post survey as well, what made you want to take this course? And a lot of them just say it was the only thing that worked with my schedule. And so we know we have our work cut out for us. And we don't want to necessarily tell them what to think or how to think, but we want to present them with different perspectives and to help them kind of allow them to come to their own conclusions. And I think especially with this course, when you have a 100-year-old sitting in the class next to you and who's actively participating, it can change your views on ageism really, really quick. And we did have, he was 99 last year in our class, and he was an active participant. And we had Florene, and we had people who were, living at Christie and who are in their 80s or 90s, but are still very vibrant and very connected to the community. Probably more active than I am, probably. And so it can really change your perspective on things.
Yeah, and having the students right there,
yes,
in person and meeting and conversing with folks who they're all students at the end of the day, regardless of the age.
Yeah, and it goes both ways for the older adults as well who are in the class. We did focus groups after last year's class, and one of the residents who was in the class said that it really changed his perspective on younger people and just students, and he has a greater appreciation for younger people now. He was saying that he just shows up one day a week to a 2-hour class, and it already kind of takes a lot out of him. But to think that students have a full course load, sometimes 4 or 5 courses, and they're still working, they have personal responsibilities at home. He said it changed his perspective on how he views younger people. And so that's what we wanted, because ageism, it can go both ways.
True. I had a lovely conversation with George when I was attending the last class there, and George had performed a little song, played his guitar, but I was chatting with George and his wife, Virginia, I think, or Georgina. Virginia, I think her name was. And, I asked him, what brought him here. And he said that he's 99 years old, that he used to go around to a lot of seniors' homes, long-term care homes, retirement homes, and perform for the seniors, for the old people, he said there. And I got the sense that he just didn't see himself as being one of the old people, that he was really there as an entertainer and bringing something to them. But I asked him what his career had been, where his career had been, and he said that he was an old newsman, and he actually was one of the columnists for the Report on Business with the Globe and Mail. And I went, wow, that's I remember reading his articles, back several years ago. But I think it's an example of sometimes we don't see beyond, what we visually see in the person. We don't see who that person is or who that person was. And it seems to me that one of the values, as we've discussed, of this program is that both the older learners and the younger learners see beyond, just the visual. Florene, do you have anything to add on that one?
Well, I just wanted to say that one of the things that was confirmed for me is that we have a sick care system, not a healthcare system. And so it's extremely important as we age that we take responsibility for ourselves. And for the young people too, I think they don't appreciate how much they have to look at themselves and stay healthy. So that was really a big thing for me in this course.
Mm-hmm. Yeah.
I can add that. I can respond to that question. I think part of the work that we do is to really help make the life of that individual really visible. I think that, George is a great example. Florene is a great example that there is more to the person than the age of that individual. And, and Florene's background as a lawyer and the fact that Florene went back to law school in her early 40s, I think sometimes all of these stories and experiences are lost when we view the person simply as an older person or as their age. And we work really hard to emphasize in that class that all of these people in the room, whether you're a younger person who's 19 or you're an older person who's 99, there's a rich life history that already exists there. And we work really hard to explore that and to make it visible.
Mm-hmm.
Yeah, very much an important thing. And, even things like in some long-term care homes where they have memory boxes at the door, and the residents are able to put in, just different things from their lives, different mementos, whether it's photos or awards they've received in their lives and so forth, as a way to really share with people who are either visiting or the staff working in long-term care that this is a person who has a life and who has had varied experiences in that life and need to continue to be recognized for the life that they have led and the life that they have, as opposed to being seen as just somebody in a bed in long-term care. And, to me, that was always something that struck me as a small thing, but a very important thing to establish in our minds, that these are persons who have lived experience and lives and stories to tell. And I really got that sense sitting in the classroom that day, that people are able to share these bits and have those experiences brought in as examples to whatever is being discussed in the program that day.
Mm-hmm.
Yeah, and maybe Jessica, you can talk about the intergenerational interview as a real gelling point.
Yeah. I was actually just gonna bring that up. So one of the first assignments that we have the students do in the class is called the intergenerational interview. And so we pair up a student with an older adult from the class, and the student has to have a conversation with this person. And it's about a 45 minute to 60-minute conversation, and they record it and they submit it and they do a reflection afterwards. And what I did last year was we had every single person in the class fill out a form. It was a list of topics where they could check off topics in health and aging that they're interested in. And we would match them based on common interests. And at some point, it was I ended up matching them based on just what we learned about them, personality-wise, and what their interests were outside of class as well from the first few weeks that we had been with them. And I'll say for the most part, I'll say like 90% of these matches worked out pretty well. Alexis actually had the pleasure of interviewing George as her partner. And I think that was the turning point in the class. For the first few weeks when we came into the class, it was students sitting on one side, older adults sitting on one side. And I think after that, I think people really kind of came together, and you had that one person or that one friend in the class that you had a strong connection to. And people were laughing and hugging and dancing and making TikToks with each other during class. There were some really good bonds, like very strong bonds that were created. And I do think that assignment was kind of that turning point for the class. And I think it was an opportunity for these two people of, a 20-year-old and an 80 or 90-year-old to really come together and really share their stories with each other. And it was what you were mentioning before about the mementos and having that kind of legacy in their life story. They were able to share that with the student. And this 20-year-old is able to see this 80 or 90-year-old as more than just, this older person. And they really had a story to share. And one thing that we saw from the assignments and the reflections that were submitted was that the students were saying, we had more in common than I thought we would. There was more in common that we had than we didn't have in common. So that was very special for us to see.
Yes.
Christina, if I could just add something.
Yeah.
I was telling my granddaughter, who's 28, about this course. And I asked her about her relationship with older people and how she felt. And she summed it up by saying that young people often get lost in the weeds, and it takes us older folks to help them find their way out. And I always thought that was lovely. And that, I think, is a good explanation of what's happening in the course as well.
Yeah. Yeah. One of the things that we often talk about in the sector that I work in is how can we get more of this sort of intergenerational understanding happening across healthcare, the healthcare system, and within all disciplines of healthcare delivery. So whether it's primary care, other clinical areas, pharmacy, so forth. Have you given any thought to, what the learning from this program has given that could be of benefit to other disciplines within academic disciplines within this area of aging?
I can address that for you because we've been imagining all the different ways that this program could be scaled, replicated, and expanded. And what we were really lucky to have in our class, for example, is a person who's potentially been a principal. We've had physicians in the class, psychiatrists, former lawyers, etc. And so when I've had this conversation with other academic colleagues of mine, I've said, imagine, you're teaching a class on marketing in the MBA program, and you have 25 retired CEOs or older CEOs who have lots of experience and have navigated the ups and downs of industry, for example, for 30 or 40 years, and you have them in a class with students who are in the MBA program right now, or nurses who are retired or in some way working part-time, and they don't have a chance to work with new learners, and you put them into class again with newer learners, and they get a chance to share their experiences and really exchange their views on things and how that could be helpful, or in pharmacy or in medicine, the same thing. So I think that intergenerational opportunity for learning is there, and this program could really serve as a blueprint for that exchange and knowledge sharing that really can happen. But I think really what this is about is highlighting that there is a lot to be shared between generations, and it's not simply about older people telling younger people that this is the way that you should operate, but an opportunity for learning and exchange is, I think, the key here, and we see it expanding to all sorts of different ways.
Well, let's hope that we could get to that point. So just we have a couple minutes here to wrap up now. So what happens next?
Well, I'll let Alexis start, because Alexis is one of our sort of success stories, if I could say, to say, this is the impact that we can have on an individual. So maybe Alexis, you can start.
Absolutely. This course has had such an immense impact on my life, like I said, or I guess going back to the intergenerational interview assignment, even, I'm still very close friends with both of the individuals who I had the pleasure of interviewing last year. So if we could continue to bring this opportunity to undergraduate students next year and for continuing years, that would be fantastic. We're currently, like Raza mentioned, also looking at ways to scale up the initiative for other settings. Hopefully we can bring it back to Christie Gardens next year. I personally found that the course unlocked a door for me in pursuing careers in gerontology, or seeing what my options might look like in that sense. So if a course like this can do the same for even just 1 or 2 students each year, having more people in the field who have also had experience firsthand interacting with older adults would be incredible.
Thank you. Florene, any last comments?
Just that I think it's important that in any profession, you have to either know your client, your patient, your customer, and if you don't know them, then you can't work with them properly. And so this course needs to continue.
Thank you. Jessica?
Yeah, no, I would love to continue this. There's, from going to events and conferences, there is definitely interest in this. People are, there's buy-in and people want to do it. And the fact that we were able to take a course off campus and to get the buy-in from, you know, the university level and from all the levels that we needed buy-in from, there's, you know, it's, yeah, there's definitely interest in this. And if this is a way to get more people interested in aging, I am all for it. Aging is, I from what I see, it's always this kind of the smallest cohort. Especially that was the case when I was doing my master's as well, in gerontology. So if this is a way to get more people interested, I'm all in.
There's certainly a big market, and it's only going to get bigger. And last word to you, Dr. Mirza.
Well, I'll say that, you know, we have to be very intentional in our approaches to bringing people of different ages back together. And I think this is one of those ways. And again, just that there is so much interest in the class and so much excitement is telling you that people want this. And, you know, and in many ways, we've been unintentional in bringing people apart and separating people by age, you know, whether it's because they live in a retirement community and they don't get a chance to interact with younger people, or because in the university or classroom setting, we don't see people after a certain age because that's a rite of passage. So I think we'll have to continue to facilitate programs like this one and others, with working with stakeholders and partners like yourself to bring people of different generations back together, because there are benefits for the individual like Alexis or Jessica or myself or Florene, but also for our communities and for society in general. And so we'll continue our work forward, and we look, you know, excitedly towards what the future holds.
Well, I hope the future holds more of this, because it's absolutely needed, you know, across the board. And we see the value. We really do need this kind of programming in order for us to be able to better serve the aging population, and also to support those who are coming behind us, and ensuring that when they get to this point, that they're also going to be able to continue to live full quality lives with dignity in their aging. I want to thank you all so much for agreeing to be here on our program and taking the time to share the experience of the intergenerational program at Christie Gardens with the University of Toronto. It's been really interesting for me. I hope that our listeners also get enthused and see the art of the possible, and you know, that hopefully we'll all keep our fingers crossed that whoever makes the decisions at U of T, and which is my alma mater, by the way, and Christie Gardens to continue what is obviously such an important and valuable program. So Dr. Mirza, Florene, Alexis, and Jessica, thank you for chatting about aging in our community with us at Chats. And to all of you that have joined in and listened to the program, I hope that you found it as interesting and exciting as I have. And who knows, maybe we can see this actually spread and scale up into York region where Chats is located. So thanks again, everybody, and we'll see you for the next episode.